It's 2 o'clock, so let's hit the broadcast and see what's going on here. So, well, hello. I just wanted to welcome everybody. We are also on Facebook Live, and I just wanted to kind of touch base real quick. I'm going to go to a screen share for just a moment as we do the introduction. So I'll be back to all of you here in just a second. But this is our event today. Life Co-Pilot is the host. We've invited a group of people here today that we're very excited about, who are all part of the free services and no-cost services and things that are available for our seniors. So, you know, I don't know if Kate is here with us yet or not. If she's not, we'll catch up with her when she gets on. Nancy, is Nancy here yet?
Yeah, I'm here.
Kate is here.
Nancy, so I'm going to let you go ahead and introduce yourself.
Okay. Hi, I'm Nancy Shell from Shepherd Center of Hamilton County. We help seniors remain independent and in their homes for as long as safely possible.
Excellent. So you're in Noblesville is where you are?
Our offices are in Noblesville, yes. We hold our programs all around the county in different churches.
Okay, very good. Andrea, would you like to introduce yourself and explain who HAND is? And you're so far from Shepherd Center.
Yes, we're neighbors.
Yeah, our offices are right next
to each other. So I'm Andrea Davis. I am the executive director of an organization called HAND. We develop and preserve affordable housing in the suburbs, and the vast majority of our rental units are for seniors. So these are income adjusted rents. So low income seniors get lower than market rate rent. So we're just trying to help folks stay housed and comfortably and safely for as long as they can live independently.
Excellent. Linda.
Hello, I'm Linda Handy. I'm with Prime Life Enrichment, and we work with seniors regarding fitness, where our center is in Carmel. But we're for the entire Hamilton County. So we work with fitness, transportation, and helping with any issue that you have.
I don't know if Stacy is here yet. Is Stacy on? If not, we'll catch up with her later. Cindy. Hello, Cindy. I know you're going to go close your door. Did I get further out the door? We'll come back to her because she was going to be going to close her office door.
Actually, this
there
is
you
Mel.
are.
This is Mel. I'm sitting in for Cindy.
Oh, okay.
So I'm Mel from Trinity Free Clinic, and we are a free clinic for medical and dental services for those who are uninsured or underinsured in Hamilton County. And specifically when it comes to seniors, Medicare Basic doesn't provide vision or dental, and so we are a great resource for seniors who need vision or dental services.
Well, thank you. I don't know if Kim is here yet or not. We'll kind of throw the thing out because I can only see so many people at a time. So I'm not sure if Kim's here. I'm not sure if Madison's here.
I'm here.
Okay, go.
Hi, I'm Madison. I'm with Morning Light, and we operate a free residential hospice home for the terminally ill, 6 months or less to live, can come stay at our home for free. It's a 12-bedroom home, and it's for people, you know, who are low income or just don't have a proper living situation or anyone to care for them in their final days of life. So they come live at the Abby Hunt Bryce home here in Indianapolis.
Thank you. Hadia.
Hi, my name is Hadia So, and I'm with the Alzheimer's Association, and we work to help families and those living with Alzheimer's and dementia find the care and support that they need to manage dementia. And so we provide education so that people are aware of what Alzheimer's and dementia is, and also provide free resources so that they can find support and care within their local communities. And we also work to help physicians connect with us so that we can connect early on with families who are experiencing Alzheimer's and dementia.
Thank you, Hadia. John.
Yes, my name is John Cosgrove. I'm the administrator here at Together Home Care. We have 6 locations throughout the state of Indiana, primarily working with families under the Medicaid benefit. We can obviously work outside of that as well, but the majority of our families are within the Medicaid realm or umbrella, if you will. So we work with both pediatric and adult, skilled and unskilled care, and we provide both prior authorization, and we work with the waivers as well. So A&D waiver, which is agent disabled, and also traumatic brain injury. So we love to be a resource, obviously, for all the families in need, but also can provide the service for them as well if warranted. So, yep.
Excellent. Beth, are you here? Kate, I see you showed up. So hello, how are you?
Hi, I'm great. Hi, everybody. My name is Kate Kunk. I'm a caregiver options counselor for Sequoia Aging and In-Home Solutions. And of 350 or so employees at Sequoia, I coach family caregivers. I'm a registered nurse. My colleague is a clinical psychologist. And we are two of all our employees who are working with caregivers specifically. Sequoia itself reaches out to anyone of any age with a disability and their caregivers to achieve the greatest possible independence, dignity, and quality of life. And we do that in quite a variety of ways.
Thank you. Let's see, who did I miss here so far? Kim, are you here?
Yes, I am.
Okay.
Hi. Thanks for having me today. I'm with the Indiana Parkinson Foundation, and we offer programs and services for those living with Parkinson's disease and their families. We have an exercise program called The Climb, support groups, virtual classes, and educational events.
Excellent. So I'm not sure if Stacy's here yet or not, but I'm going to go back and get off the share so we can actually see each other. So that'll be nice. So now I'm very excited about having this group. I will tell you that I was dealing with my own family and their needs and what have you for many, many years. And it wasn't until I somehow or another got on the board at the Hamilton County Council on Aging that I found out that a lot of you guys even existed. So I know there's got to be okay, we got Beth is here. Hang on a second. I'm going to get her switched over. I think probably she's on let's see if I can find Beth real quick. Oh, here we go. Beth, you have now been promoted to a panelist, so you should be popping up here a second. So before we go any further, Beth, would you like to come in and introduce yourself? I think you should be there now.
Okay, sorry, I don't know, that was so weird. I don't know what happened. I was sitting here and I was not really here, which is so typical for me. Good afternoon, I'm Beth Gelhausen. I'm the director of Meals on Wheels. We serve folks in Hamilton County, throughout the county, that need some assistance with nutrition. Our goal is much like Shepherd Center. We want people to remain independent, living in their own homes for as long as possible. So we provide hot meals Monday through Friday. There's an option for a cold sandwich supper with that. And then we also provide frozen meals for weekends and for folks who need additional nutritional supplemental help. So that's all. Thank you.
Excellent. Well, guys, thank you so much for your time today and joining us. I think this is an important panel. Like I was just saying, that I didn't know a lot of you guys existed, and in fact, some of them were, well, like for this sounds crazy, but I really didn't know anything about Sequoia even, and they're a major player in the whole thing, but no one told me, any place I went, nobody said, hey, go talk to these guys, so I really would kind of like to talk to you guys about and whoever wants to field this question first, and then just all of you take over, kind of explain how does someone get to where they meet you guys? How do they get their services? How does someone go about engaging with you? So right now, big on my screen is Beth. I'll let you go ahead and start. So you're muted here. Hang on a second.
There, can you hear me now?
There you go.
Yeah, thanks. I really want to hear that I'm big on somebody's screen.
Well, I got the little screen and the big screen. So yeah.
Sorry, I'll be serious now. The question, how do people find us, get to us? We work with the folks on the screen, we get referrals privately, publicly, from discharge planners at hospitals, rehab facilities, doctors who want to keep their folks living at home and are feeling like they're not getting the nutrition that they need. We are one of those organizations that the name Meals on Wheels has kind of been around for a while. Doesn't mean everybody always understands what it is we do, but or whom all we can serve. But we are kind of one of those folks think of us sometimes just because they've heard of us somewhere. So we just receive referrals from all over. And I do want to mention real quick too that our program serves the whole gamut of folks with various financial backgrounds. So some of our people fully pay for meals. Some of them, we provide their meals at no cost. So there's that whole scale in there.
Okay, very good. John, tell me about your entity. How do you guys work?
Yeah, so we receive a lot of inquiries about services, whether it be word of mouth and obviously current patients or individuals that we're caring for in the community. You know, their families obviously talk with other friends and families throughout the community. So we get a lot of inquiries about services through that. We also work very closely with Sequoia. I would say working with the Medicaid population, 95% of the individuals that we care for are actually through the Sequoia group. We have a lot of great relationships with their case managers and care managers there, and work quite closely with them. Another way that you can locate a provider is through Indiana State Department of Health. They have what's called a pick list. Obviously being patient choice, there's a long laundry list of companies out there that they could contact to inquire about home health services and what each provider can offer them and their family. But for us personally, yeah, it's been a great relationship with Sequoia. They've been a great group to work with over the years. So,
excellent. Kim.
Yes, so we get referrals from neurologists, obviously, when someone is diagnosed with Parkinson's, and also through physical and occupational and speech therapists when they've been working with them for maybe the Big and Loud program. But honestly, people can just pick up the phone and call our phone number, which is 317-550-5648. They can hop on our website, which is indianaparkinson.org. So there's many different ways they connect with us. They don't have to have a referral, and we are more than happy to walk them through whatever questions that they have for us and help them with either education, resources, support, or exercise.
Okay. Linda.
We pretty much is the same way that Beth was talking about. Through referrals coming in through hospitals and Sequoia. We also get a lot of calls from referrals from 211 phone number that people can dial and get information from. And so, and also their children, you know, because we're dealing with seniors, a lot of times the children will get online and research, and so they will send emails asking questions, and so pretty much the same way everyone else is.
Okay. Nancy, would you like to talk about Shepherd? I lose Nancy.
Yeah, I'm here.
Tell us about, yeah.
Okay, yeah, we get, I was going to say the same as Linda, as far as we get a lot of families going online, researching, and then they give us a call to find out what exactly we can do to help their families. We have a lot of discharge planners from Riverview, IU, St. V's that give out our information, and the families contact us, or the individual contacts us when they get home from rehab. Those are two of our main referral sources.
Okay.
A lot of word of mouth.
Oh, sorry. Word of mouth.
We get some word of mouth, a lot of word of mouth. The participants that participate in our social program, a lot of times either know someone or they themselves find the need to become a Reaching Resources client. So,
Linda. I'm sorry. Andrea is who I meant. Yeah, I'm sorry.
Easy to mix this up, the glasses and all. Yeah, word of mouth is probably the most common. We started developing rental communities about 10 years ago. And once folks moved into our properties, they started telling their friends. So we have 88 senior rental units in Hamilton County and a waiting list of more than 200. It's actually been closed for over a year because we were finding that our turnover is very low for a multifamily property. You know, our seniors love where they live, and we've had residents literally tell us they're going to have to carry me out of here. I'm never going to leave. So with low turnover and a limited number of units, we don't need to do any advertising. We do kind of do some naturally. We built a development in Carmel a couple of years ago, and the first tenants to move in there found out about it just simply by driving by while it was under construction, and were curious about what it was, found out, and there are model tenants, I think, out there.
Well, very good. So my screen that I was using keeps bouncing around. So anyway, so Beth, would you like to tell us about you? Beth, I lose you?
You already called on Beth.
I was going to say, you.
Oh, yeah, that's right. We started there.
I mean,
This thing's
have
been
to
jumping
speak
around. It's
again.
driving me crazy. I thought I had this all figured out, and now it's playing a game with me. So, Hadya.
Similar to a lot of the organizations here, we also rely on community members to reach out to us and say, hey, you know, someone could use your services. So that's why we tell everyone, even if you find out this information but you don't need it, someone you know might. We have a rapid referral form that we encourage healthcare professionals to utilize. So whether it's a social worker, a physician, or a nurse, anyone can use that referral form and say, hey, we've got someone who's experiencing signs of dementia or has a diagnosis of dementia. And then once they give us that referral, the job is no longer on the person, and now it's on us to reach out and say, hey, are you okay? What can we do for you? We also encourage people, much like Kim said, to call our helpline. And the helpline number is 800-272-3900. And that's 24/7 every day of the year, even Thanksgiving. I'm not there, but someone's there to answer your call. And then we also encourage people to check out our website, alz.org/Indiana. And of course, the moment I start talking, someone comes to mow the lawn. This whole time, no one's been making noise, but so thank you.
Okay, so Kate, would you like to talk more about how would someone interact with Sequoia?
Yes, I would love to do that. Thanks. I think that I could say all of the above to basically everything that's been said. Very often there is some thing that just sort of initiates the obvious reasons for the need for Sequoia services. For example, somebody has just fallen, they're in rehab, and the family is going, okay, what are the next steps? We're just, we don't know what to do. We don't know who to call, what, you know, how to start or whatever, but mom, you can't go home again. And so it's usually staff in, well, I shouldn't even say usually, we get calls from everywhere. And when I joined the Aging and Disability Resource Center about it's been 11 years now, there were 5 of us taking calls for intakes, and now there are 18 minimum on the phones who are doing the eligibility assessments, and those come as a result of families who are out of town visiting for the first time in a long time, and they're suddenly seeing, you know, rotted food or whatever laying around or something like that. They just have to put things into place. Very often we hear, oh, I wish I had heard about you 10 years ago. And that's a big problem for us. So we are on, we're in the media quite a bit, Facebook, television commercials. I'm sure you've all been in the field for quite some time, I'm sure. And so aware that we do quite a bit of advertising. And so we just work to address the needs of people. And they're primarily, they may start out with the need for meals, but they can't afford them, or the need just to get to the doctor's office because they have nobody to take them. So Sequoia has these transportation services and meals and And then, of course, the help with personal care at home, which Sequoia does not do. As an agency, we are the liaison between the individual and the state and the provider agency. So we kind of get everything rolling, and as the needs increase, we hope to be able to meet those needs until it is time that the needs can no longer be met. And then we're usually the last stop before somebody is needing to do something more dramatic, like nursing setting for residents, nursing home, in other words. So I hope I answered the question.
Very good. Well, thank you. So
participating in this whole thing. So forgive me if I ramble, and hopefully
you have a pretty big plate full of stuff there too. So, you know,
yes, yeah, we do.
So Madison, tell us about how someone interacts with you guys, and how's that start and go?
Sure. So being hospice, we work a lot with hospice agencies in the area. So, you know, if they have a patient that they think might need somewhere to live, they would work with our provider relations specialist, Andrea Davis, who does all our admissions and intakes. She's out and about in the community quite a bit, kind of spreading the word. We work, you know, hospitals as well. But also a little bit word of mouth. You know, we do get families that call in who have heard of us and need somewhere for their loved one. So mostly though, through our provider relations specialist, she's been, you know, super key in terms of getting us out in the community.
So now can you explain the difference between Morning Light and Abby, you know, Hunt? I keep messing it up, so I don't have it in front of me.
Abby Hunt Bryce Home, yeah. That's the actual home that we operate. Morning Light is an umbrella. So we actually have a senior living facility as well for low-income seniors called Penwood Place. It's actually right next door to Abby Hunt Bryce Home, but we operate both of those. So, you know, our charitable mission is the Abby Hunt Bryce Home, but we also do oversee it's 38 units, Penwood Place Apartments as well.
Okay, well, thank you very much. Mel.
Well, Trinity Free Clinic, a lot of our referrals come from the county health department or from township trustees, and also a lot of churches. And word of mouth is probably the main way that people find out about us, but also emergency rooms and dentist's office. When someone calls and they need care and they can't afford to go to the dentist, they'll often refer them to our clinic.
I stumbled into you. I came to one of your luncheons where you were kind of introducing to community, okay? And that was kind of my eye-opener that it was even there, you know? And then I've been involved in your charitable things where you're doing the fundraisers at different times. The scope of work you do blew me away. I had no idea. So if you'd like to expand on that, because I have a lot of people, I have a funny feeling a lot of people have no idea that there is this much need for a charitable free clinic, medical clinic, and dental clinic in Carmel.
I think a lot of people are surprised because Hamilton County is the most affluent county in the state of Indiana, but there are a lot of residents that live below the poverty line. And so we're kind of that safety net for them to help them, you know, it might be temporary, maybe they've lost their job, so they've also lost their insurance, or it could be, you know, something that's they've been really putting their healthcare off for a long time because they haven't had the resources. So I hate to say we're the best kept secret because we don't want to be a secret. We want to get the words out. So I'm thrilled to be meeting all of you so that hopefully, you know, we can kind of share in that referral pool, because I think that I see a lot of our clients are probably very, you know, much in common. And but on the medical side of Trinity Free Clinic, we have a vision care. So we offer full vision screening and eye exams, cataract testing, and we have an optician that will fit you with free glasses if that's what is needed. On our medical clinic, we have acute care. So if you're sick, and I kind of look at it on the same basis as like a minute clinic, where for common illness and injury, you can come to Trinity. So, you know, if you're having chest pains or really severe abdominal pains, we want you to go to the emergency room. But, you know, if you've got an ear infection or an eye infection or need basic medical care, we want to be here for you. But we also have a podiatry clinic, which is something that is definitely a need for seniors. And we have a hypertension clinic, and that is for people who their blood pressure is under control, or it's pretty well maintained, but they need to see a doctor. So a lot of times the prescriptions that are prescribed, they're only $4. You know, they're all, you know, formulary, they're all generic. So our patients can afford the medicine, but they can't afford the doctor visit to, you know, keep their medications on pace. So they could come in and we'll do the weight checks and the blood pressure checks, and just be that check-in for them, so that they don't have to go see a cardiologist every time they need to, you know, get, you know, a prescription. So that's what we do on the medical side. And then on the dental side, we also do women's care. And on the dental side, we do comprehensive exams, and we do fillings and extractions. And we also have, specifically for seniors, if a senior needs more care than we can provide, we do, with our comprehensive exams, we can do panographic x-rays and the things that'll really start to make your bill add up at a dentist. Even if we can't treat you here, you can come in and get that comprehensive exam and your x-rays, and we can send them anywhere you need us to help you keep expenses down.
Excellent. Well, thank you so much. Because like I said, it was real eye-opening to me when I walked into there.
Yeah, it's an amazing place.
One of the things that you just said that's going to trigger the next question I'm going to ask Hadia is you made the comment that you're the best kept secret, but you don't want to be. I remember sitting down with Julie Moore, and she was telling me at one time you guys have like 6,000 people that you serve, of maybe 1 million that should be, or hundreds of thousands, but people don't know about you. So would you like to fill us in on all the things that you do, the scope of things, and how to get word out? So,
Man, would I? It's kind of like when Kate earlier said that people will often say, oh my God, I wish I'd known about you years ago. If I had $1 for every time I heard that, and between my colleagues and I mean, you know, it really breaks your heart when you hear families say that, because then when you're doing this, you just want people to know that they're not alone, right? And so if you don't know about these resources, it can often feel like you are. So with the Alzheimer's Association, we just try to push as much as we can so that people know that regardless of if you have basic questions about Alzheimer's, like what is Alzheimer's, what's the difference between Alzheimer's and dementia, all the way to how do I talk to my family member who's experiencing these symptoms, or how do we prepare our legal and financial affairs? We have answers to all of those questions. And so we provide these answers via our education programs, which even with everything going on, we've been able to switch to virtual. So that's been really, really good. That I think it's great that Jim and I actually were talking that we don't have to drive places to see each other. So people who couldn't attend some of our programs before because they couldn't make it are now able to just tune in. You can either call in or you can get on a Zoom call just like this, and you can learn about all of these things. We also have our support groups that we've been able to move to a virtual setting. So being able to sit in a space like this and talk to people who are experiencing similar issues as you are can be really helpful in navigating this. You know, you're able to ask people, hey, have you heard about this facility, or have you heard about this resource? We can do that kind of community sharing in a support group, and it's a safe space for people to come and talk to one another. So these are all resources we really, really don't want to keep secret. We want everyone to know about this. We've also been doing Facebook Live so that maybe we can reach out to people via this platform. But I think definitely just encouraging people to call in the helpline, or just to reach out to us and say, hey, this is what I'm going through. Hey, I have questions. What can you help me with? That's kind of where we are. So encouraging people to reach out.
very good. Linda, I have been to this big, beautiful facility of yours and have seen all the different magical things behind different walls. Would you like to explain more about what Prime Life is all about?
Sure. We focus on every aspect of the senior life, them to keep moving for one thing. We have let's see, in 2019, I put together over 20,000 fitness classes. So there's something for everybody. We have social activities was 19,000 activities last year. Transportation, we did 6,000 trips for the year. And so that is, you all have seen people who are driving who should not be driving. Our goal is to convince them that we're not taking away your freedom, we're keeping you safe. And so we do hair appointments, grocery shopping, of course, all medical, dialysis. Transportation is there. We just got another 4 vehicles during our COVID shutdown, of course. So we're just slowly ramping that back up. But there's ways to stay in your home and still get out and do what's necessary. Of course, we rely on many of the agencies that you are talking to today. For example, the Shepherd Center. If somebody needs food, we'll set that up for them to do deliveries there. Or Sequoia, who's bringing in meals. Of course, Meals on Wheels. So we're all intertwined in one way or the other, helping the seniors have a full balanced life and not be missing anything. And so the key is good communication. The key is encouraging the families to not be doing it on their own. You don't have to do it on your own. We've had seniors come in here where we've helped them balance their checkbook and convince them to let a family member take over the finances. We've had where we've helped them get insurance and just odds and ends. It's a place to come for many reasons. And we do what we do because of everybody else that's here as well. We're definitely a team.
Excellent. Nancy, would you like to tell us more about all the different scope of services and stuff that you do at Shepherd Center?
Well, we have a lot of different programs. Our oldest program is our Together Today program, which was meeting at churches 5 days a week. And they would play cards and games, have lunch, and have an activity. Since the COVID virus, we have been actually having a Zoom meeting every day at 10 o'clock for as many as can get on. We've had up to 30 join us, and they have conversation and usually a riddle, which they really like the riddle. And then they play bingo quite often or other games. Our community caring program has turned over into, which used to be a group of volunteers providing transportation and house cleaning and prescription pickup, doctor's appointments. That's kind of turned over into a grocery delivery program right now. We've collected donations and are funding some of the grocery shopping ourselves. The Hamilton County Sheriffs actually go shopping every Thursday morning. Yeah, there's like 4 guys, and they actually go to the grocery store with a list that Lisa makes out for them. They bring everything back here to the office. They sort it all out, and we add in the products that have been donated where we can. And they go out and do between 15 and 25 deliveries every Thursday morning to seniors in need. We've had, since COVID hit, we've had a phone pal project going where we've had over 200 volunteers of phone pals, and they've covered about 100 of our clients, calling them twice a week, talking to them, reporting to Lisa if they needed groceries, reporting to me if they had other problems. So that program is ongoing as long as we're in this COVID situation. We have our Reaching Resources coordinators. We have 3 of them. Kate, I had to smile when you said you've grown from 5 to 18. We've grown from 1 to 3 when we could probably use 3 or 4 more. They actually go out and meet with the seniors, take them in as clients, determine what needs that they have and how we can best help them be filled with resources around the community. A lot of times using a lot of the people that are on here today, Beth from Meals on Wheels, Linda for exercise at Prime Life, Andrea, if they need low-income housing, has helped us out several times. And then our newest program, which I'm proud to announce, Shepherd Center is now housing a guardianship program for senior adults 18 and over in Hamilton County. We just provided training last week for about 10 volunteers that are interested in actually taking on guardianship programs with us. So that's underway, and you'll be hearing more about that soon. So it's just about ready to go.
Excellent. And you also do something for the professionals in the industry. You have a gathering for like a brainstorming session. Would you like to mention that?
Oh, yes.
This may go out to a lot of professionals too.
Collaborators meeting, which started out with a small group of people that helped us get funding for our Reaching Resources coordinators, and has turned into quite a large gathering of people that are interested in seniors in Hamilton County that have needs. Out of that has come a mental health task force and a food insecurity task force. So we try to identify between the group of us some of the needs and figure out a way that we can all work together to help fulfill those needs.
Excellent.
Thanks, Jim.
Andrea, would you like to talk? Nancy just did a nice segue into you as far as how on the low cost housing and what have you.
Right.
You and I have talked, and we were talking about different things about trying to get your reach to go out into different towns. First of all, maybe where all you are, and then how could we help you grow that as far as getting people participating to help you grow this, because you're always rented out. So yes, I'll let you kind of come from there.
Great questions. So HAND started out, HAND is actually an acronym for Hamilton County Area Neighborhood Development. But in 2018, we actually acquired a property in Boone County. So we started using our acronym as our business name, just so that our Boone County friends didn't feel left out. But for the first 10 years of our development history, we were focused entirely on Hamilton County. So we have our largest property is a 60-unit duplex community in Sheridan, which is kind of northwest Hamilton County. We also have senior communities, 2 of them in Noblesville. One is in the Pebblebrook Golf Course community, and then one is in the Southwest Quad, kind of south of downtown. We have 5 units in Cicero, right on State Road 19. If anyone has ever driven State Road 19, you've driven by them. 5 attached units. And I mentioned earlier in 2018, we built kind of an unusual project for us. Is a multi-generational community in Carmel. So we have 8 units there for seniors and 2 units for clients of Prevail who are referred to us. So these are folks who have survived some sort of violence in their life and just need a little help kind of getting their things on the right path. Then as I mentioned, when we bought a property in Boone County, that's not age restricted, but we certainly have a lot of seniors living there. It's 17 duplexes on 2 cul-de-sacs in just northwest of downtown Lebanon. It was a community that was built in the 1950s. And so we acquired it and are in the process of doing significant rehab work to it to kind of bring it up to modern day standards. We're always looking for opportunities to continue building. Our sweet spot is typically 5 to 10 or 11 units. We do have the larger property in Sheridan and the one we acquired in Boone County, but all the rest of our properties are 14 units or less. We find that we can fit into an existing neighborhood a lot better at a small scale, as opposed to what a lot of people think about when they hear affordable housing, or the projects of the 1960s and 70s that were these big monolithic towers that were just sort of overflowing with folks. We try very hard. Affordable housing in 2020 looks very different than that. We try very hard to fit into the communities where we build. So we do have, we are not yet in Fishers or Westfield in terms of the larger communities in Hamilton County. And although we do have properties in Sheridan and Cicero, it's difficult for us to get funding to build in sort of the northern tier of the county because those areas lack access to amenities like grocery stores and healthcare facilities, trails and paths. And since we don't have regular scheduled public transportation in Hamilton County, that can be a barrier for folks. So Fishers and Nobles and Westfield are probably on the top of our, we'd love to find some property there. The good news about the fact that we build sort of small scale developments is we don't need a lot of space. We're actually have a project on the drawing board right now. We've received funding. We're just kind of going through the development plan review process in Tipton. We're going to build 7 units on just less than an acre of land in a subdivision that just development stalled, and so we acquired the last 5 lots there, and we're going to build 7 units there. So we really, for 1 acre is probably a little tighter than we would like, but 1 to 3 to 5 acres, close to amenities, not just for seniors, but also for workers. We find there's a big need in Hamilton County as our communities start to add more jobs. It used to be the suburbs were just sort of where you went to go home at night. And as these communities have started doing more economic development, we're finding we really need some places that the people who work at IKEA and Topgolf and the Grand Park Sports Complex, they want to live close to where they work, just like we all do. So that's not to say we've shifted our focus from seniors. We think there's a very big need. We really believe that our elders deserve the dignity and independence that come with having a place they can afford to live in and not have to worry about, how are you going to pay your rent or mortgage. But I think we've seen a couple times recently, the Star has written about the fact it's just really difficult for empty nesters in our housing market to sell their family home where they've raised their children and move into something smaller without taking on at least the same size mortgage, if not a larger mortgage, because our housing prices have just gone out of control. So
there is a solution for that can do it is with a reverse mortgage purchase, but that's that works
that's
really
another
well.
topic.
I was going to say, anybody that thinks that what do you call it, housing price, price controlled housing is always looks like the same thing. They've not been down 106th Street. Those are cute little bungalows that you have down through. Those are very cute. Beth, would you like to talk a little bit about what the same topic we've been talking about? So, Beth? Is she here?
Yeah.
Okay. I can't find her here. So anyway, okay, well, let's go to John. Would you like to talk about yourself? Tell me the scope of services, how, all that kind of thing. So.
Yeah, so we kind of look at ourselves as more than just a home healthcare provider. We absolutely service our community, of course, both pediatric and adults. On the home care side of things, so we service all of Marion County and the surrounding counties. We are an Indiana-based company, started in 2014, and we are located here on the northeast side of Indianapolis in the Castleton area. And when we first started back then, it was, again, just serving that area or that community, the Marion County and the donut counties, if you will. And since then, we've been able to expand basically from north to south within the state of Indiana. We have a Fort Wayne location, Indianapolis, Greenwood, Columbus, Indiana, Evansville, and we just opened Jeffersonville. And we right now are providing services, both skilled and unskilled care. So we work with the home health aides and CNA population, as well as licensed practical nurses and registered nurses, so LPNs and RNs that service the patients in need. So you might have a patient who just needs basic ADL services, meaning bathing, dressing, toileting, medication reminders, errands, escorting, etc. And they may live with son or daughter-in-law, or vice versa, or mom and dad or son and daughter-in-law work in the community, and they can't be home with their relative. We're a company that can come in and provide that service for them while they're at work. So not only are we able to service that individual themselves, but we're also providing some relief to the family too. Again, we work with the adult population, but we also work with pediatrics. So same kind of concept there, where we might have a home health aide or a CNA go in and provide services throughout the day to allow mom and dad to work, or just to be able to kind of lighten their shoulders a little bit and say, now I can get a good night's sleep because I know that my son or daughter is being cared for by a licensed agency. And then you have obviously the skilled nursing services that we provide too for our, the community. So, you know, anybody that might have a vent, a trach, a G-tube, something with a high acuity medication management, we provide all of those services. And not only are we providing services in the community for patients, but we're also creating an opportunity for these nursing professionals and healthcare professionals to be able to get an opportunity in the community for employment. So, you know, as patients are inquiring about services, we're also trying to bridge that gap in finding somebody who's looking for a career opportunity. These are all licensed and certified professionals. And so we right now, we W-2'd about 2,000 employees last year. We have about 400 patients that we service, and we try to be a one-stop shop for our community, meaning that not only do we provide the PA services and the Medicaid services that I mentioned, the waiver services, et cetera, but we also try to help them, be a resource for them if they have wound needs or therapy needs, or if hospice is involved. We try to bridge that gap for these families so that they don't have to go out and find it themselves. If they contacted us saying that, you know, mom or dad needed services, or son or daughter, et cetera, we will provide that service for them, and then also outsource or farm out the additional services that they may need. So whether that's Meals on Wheels through Sequoia or groups like that, or DME supplies, you know, physicians that can come to their home and do travel or visiting physician services. Those are all things that we as an organization here will do for them on their behalf, so they don't have to go out and find it themselves. So yeah, you know, we've been in business now for about 6 years, servicing not only Indianapolis, but now have kind of reached out throughout the state of Indiana. And we're actually just now opening a new division, which is Together Homecare Pediatrics, which is going to focus specifically on 18 and under individuals who are in need of home care services. So we actually are starting that division actually as we speak.
That's excellent. I'm glad to hear about that one. That's new, you know, I hadn't heard, so, and needed, so for sure. So, so Kim, we haven't really talked about, we talked about how Alzheimer's Association is having a hard, you know, trying to find people to know who they are and that they're there. And we talked about that with Trinity. I think that we could probably all talk about that, but I was going to say, Kim, how do we get, what level of capacity are you serving to what you want to be serving, or what you should be serving, or what, if people knew about you?
Right. I would say I'm probably in the same boat as the others who, you know, so many people say, I wish I knew about you a lot sooner. And so I think, again, more of our, you know, professionals like us that are meeting today, more of us that know about the different services out there really help, so that we can plug each other in where needed. And currently we are serving, you know, all the way up into Angola and Crown Point, and then all the way down into Greenwood, Indiana, and currently working on creating a virtual platform so that we can reach those that are in rural communities that aren't close enough to any of our programs, but maybe need us right there in their home. So again, I wouldn't even say we have a limit on the number of people that we can serve. If we can connect with them, again, like John was saying, we just want to bridge that gap and make sure that these people have what they need between diagnosis and leading a good quality life with Parkinson's. And we want to make sure that we are not limiting ourselves also to just those that are dealing with the disease or living with the disease, because we know that the family members are also in this with them, and they need support, they need education. So again, we want to make sure that they are involved in those different areas so that they can continue to support their loved ones at home for as long as possible.
Excellent. Madison, I'm going to do the same thing with you. I have to admit, I stumbled into Tom someplace, I can't remember where, and was just completely blown away with what you guys are doing. I had no idea such services existed. So would you like to fill people in more on the details of the scope of the things that you guys can do?
Sure. So we are very much the home. So, you know, as we've mentioned a couple times, Morning Light operates the Abby Hunt Bryce home. So our role is really to be the caregivers. A lot of our residents don't have anybody in the area or at all in their life who can, you know, play that 24/7 caretaker role that hospice requires. So we work with the hospice agencies. Each one of our residents has their own, you know, hospice agency that they work with. The agency comes to the home, but we have, you know, the warm bed and the home cooked meals and 24/7 CNAs that can provide, you know, administer medication and just, you know, help, you know, turn the residents, baths, that kind of thing. But yeah, we're very much the home. We're not so much the medical piece. But people are very surprised when they come to our Abby Hunt Bryce home. They see it doesn't look, you know, like a medical kind of place. You know, it's comfortable, and that's really important. You know, a lot of people are very wary to leave their situation, and so, you know, to have that comfort is a good thing. So that's mainly what we do. Like I said, we, you know, work with hospitals, we work with doctors, just trying to get the word out. You know, just a couple years ago in our 12-bedroom home, we only had, you know, 2 residents at a time because people just didn't know we existed. So like I said, you know, we hired someone on to go out and really try to spread the word. We've tried to be in the media more so that people are aware that we are a resource. And we operate at full capacity now. So it's been great. We usually have a waiting list, but we are able to house 12 people at a time.
And your house is anything but institutional. It is not at all. It's very much a home.
That's kind of what we pride ourselves on. We really try, you know, with activities and, you know, community meals, and yeah, just the home cooked kind of meals. You know, when people come, we ask, what do you like to eat? You know, and we kind of can cater to them because it is only 12 rooms. We can really make it, you know, customizable. And we have a beautiful garden in the back. Each of our 12 rooms, you know, it opens right up to a patio. So each of our residents can go out and enjoy, you know, the sun when it's not too hot, and, you know, just listen to the birds and even garden, just kind of do the same things that you would do if you were in a normal home setting.
Yeah, I was going to mention your gardens are gorgeous. They're absolutely beautiful out there in that patio. So, you know, and I'm a big patio guy. So it's like, yeah, that's always a memory point for me. So let's see. So Kate, I can't even imagine. I don't know if you're ready to ramp up to this one, because I know that you guys basically do everything that there ever was. So I'll let you kind of try to cover the scope of Sequoia, if that's possible.
50 words or less. Right? So, yes, well, most of you are probably aware that we were begun as a result of the Older Americans Act of 1965. And of course, none of us was alive in those days, but that's, you know, many of the services that we provide are funded by Title III funds, or at least supplemented by those. And those would include the caregiver supports and transportation and the home delivered meals. So, and then for people who are going to, I'd just like to talk a little bit about funding. I don't know if you're concerned about that at all, but if you're wondering who pays for Sequoia services, well, the answer is it depends. So if you're looking for transportation, that would be the individual, but it's very, very low cost and generous, in my opinion, in terms of round trips here and there for various reasons. There are a lot of different kinds of transportation, and you can kind of look on our website at sequoia.org and just click on services and you'll see the area for transportation. And same with home delivered meals. It's called Meals and More. We get a lot of calls for Meals on Wheels because they're, you know, that's the, of course, as Beth is aware, you know, that's a name that everybody knows. And so they call us for Meals on Wheels and we say, well, that's very nice. Here's their phone number. But in any case, you know, sometimes it is someone who is specific to our our meals. And by the way, Meals on Wheels actually is, as I understand, is able to provide special diet and other different kinds of things. Sequoia has some special diet, such as low sodium, to my knowledge, but we're probably not nearly so well developed in that regard. Ours are more geared toward people on regular diets. In Hamilton and Hendricks counties, I believe a doctor's prescription is required. So, but you would want to go on our website, again, sequoia.org, very easy, CICOA, not Sequoia, not Sequoia, Sequoia, and just explore those services as mentioned. They're pretty well explained there, along with the applications for specific things, such as the transportation and the meals. Now, so those would be things that the individual would pay for. The personal help with in-home care is a little more specific. There's an eligibility criteria. If you are familiar with the waivers that are set up by the state of Indiana, you know that there is a physical eligibility for the aged and disabled waiver, and there is a financial eligibility. So very often people call and they are way over-resourced for the financial eligibility, so we refer them to an elder law attorney to kind of get everything sorted out. There are laws in place so that if someone has to go on Medicaid, the other spouse is taken care of. It's, you know, it's all, and our information and referral services are open to anyone. Those don't cost anything. And what reminded me to say something about them in the Aging and Disability Resource Center is that those services are free. You don't need to require help with anything to just call us and ask a question. And one of those questions might be, how do I find an elder law attorney who's affordable? And how do I find free legal services for somebody who has no ability to pay at all? So you can call and ask any question whatsoever and get great answers. And I would venture to say that all of the people, all of the agencies represented here today are in our database, and we do an awful lot of referral to you. And let's see, I can't think of anything else.
All right. Well, thank you very much. Beth, I don't know if you can hear me or not, so I'm going to go one more time over towards you. So
I can hear you.
Yeah, we go.
I apparently couldn't hit my mute button and keep it unmuted. Sorry. I'm very technologically challenged, so I apologize.
So tell me about, you know, the same kind of stuff we've just been talking about. Tell us about the scope of services, where all you cover. And I guess this is a question for all of you as well. Who needs, you know, who needs volunteers? Who needs, you know, resources that way as well, so we can make a shout out. We've got a couple minutes left, so, you know.
Sure. So kind of building upon what Kate was saying, we do provide the hot meals, and they are by the doctor prescribed dietary needs. So amazingly enough, people sometimes who have diabetes don't really want to eat food that is appropriate for that particular issue. And so we do ask for a doctor's script. We get that. We don't ask them to do anything but provide us with their doc's information. And I think there's 6 or 7, maybe 8 now, different dietary opportunities that we can provide. Everything from both our meal providers are in Hamilton County. One is Riverview Hospital, the other is Carmel St. Vincent Hospital. And so they strive to provide heart healthy, low sodium, just as a general rule. But we do have folks that need renal or, like I said, diabetic, that sort of thing. So that's certainly available. as I mentioned before, our hot meals are available Monday through Friday, and all of our meals are delivered by volunteers. So we have 17 routes that go out every day. So yes, we need volunteers, and we actually have a push on right now for that. We had some growth, as you can imagine, during all this COVID, and some of our newer volunteers were temporary and were home, as many of us maybe have been, and have gone back. So we are definitely looking for volunteers. Those folks, as I said, drive Monday through Friday. We also provide frozen meals. They also go out on Friday. That's another additional 9 routes just on Friday. So absolutely. In terms of what I touched on before, we do have a program where we can pay for part to all of the meals needed through a program called Sponsor a Meal, and that is primarily why we fundraise, is to be able to do that. You would ask, Jim, about you know, are we serving, I forget how you phrased it, but you know, the number of people we feel like we should be. I have been on a harangue about that probably for the last, I don't know, 5 years, 6 years. And during the pandemic, we have seen, like I said, a lot of growth, but it wasn't the magnitude that I thought it might be. So I feel like through the pandemic, we really have been able to identify some of those most in need. I certainly know we're still missing others. And I think part of that is due to a couple of myths. One being that we only serve folks who are struggling financially. As I referenced earlier, that is not the case. We have folks who fully pay for their meals. And there is still a stigma about receiving help. And Meals on Wheels, I think the thought process in some folks' minds are that this means somehow that, you know, I'm a charity case and that sort of thing. And it just couldn't be farther from the truth. As I prefaced earlier, we are here to provide some nutrition that will help with keeping folks in a healthier state, and then being able to live at home longer. So I really struggle with trying to educate the community on the needs for Meals on Wheels, and that it is not just for folks who are struggling financially. So, you know, that's just something that I guess we'll continue to battle. I would also like to point out that we do not have a waiting list, nor have we ever had a waiting list. So we're very fortunate that through the pandemic, we were able to raise enough money to at least be able to continue what we do and take on the new folks that we have, most of which have stayed on the program, I might add.
Excellent. Anybody else have a shout out for volunteers that they want to throw out there?
At Trinity Free Clinic, we always need volunteers, and we need more than medical providers. Of course, we need dentists and doctors and nurses, but we need lots of volunteers to help, you know, guide our patients, you know, through their care. So we are always happy to welcome new volunteers.
And this is John with Together Home Care. We don't necessarily need volunteers, but there's such a huge nursing shortage right now in the community, as well as even the home health aide and CNA population and that classification of employee. There is such a shortage in that regard too. And a lot of it's stemming due to COVID and the coronavirus. It's also just due to, you know, once they graduate from nursing school, they're tending to find themselves in the hospitals or private practices. And in home health care, there is such a need right now in the community, especially for skilled nursing, it's just very hard to find quality caregivers and quality nurses looking to do it for the right reasons, the oath of helping others, etc. So yes, if there's not necessarily volunteers, but if there are new grads or even experienced caregivers in the community that are looking for an opportunity, part-time or full-time, we would love to have them reach out to us to see if we can be an avenue for them.
Madison, you want to talk about your fundraiser you have coming up?
I'd love to, yeah. So every year we do a Rolling for Hope fundraiser. It's a bowling fundraiser. This year it will be at Pinheads in Fishers. And it's really fun. It's, team building kind of afternoon. And it's coming up in August 13th. And yeah, it's teams of 5. You come out, it's pizza buffet, free drink on us, and a couple hours of bowling. And it's all to raise money for our free hospice home. We are a nonprofit, so we do rely on donations. We don't have a huge volunteer need right now at the home, as we are close to visitors just to protect our residents. But in the future there will be volunteer opportunities once COVID is under control a little bit more, but we are certainly looking for supporters. So you can learn more about the event at our website, which is morninglightinc.org. And again, it's called Rolling for Hope, and it'll be at Pinheads.
Anybody else want to throw something out, or?
I will.
Okay.
So HAND every year does a housing conference in the fall where we try to educate the community a little bit about what the needs for affordable housing are, even in a community like ours, because I forget who mentioned it earlier, but there is a lot of misperception. I think Mel did. A lot of misperception about the relative wealth of Hamilton County. And although we do have some very well-off folks who live here, we also have quite a few people who do need assistance. So this year, because of the COVID-19 situation, we are moving our conference from an in-person kind of 3/4 day conference to 3 90 to 120 minute online workshops. And those are going to start at the end of August. We're going to start, our first topic is going to look at the impact of COVID-19 on suburban evictions and foreclosures and what that means for our communities. Then in September, we're going to do these one a month, August, September, and October. September, we're going to look at race and equity in housing in the suburbs, which is obviously a hot topic always, but especially this year. And then in September, we're going to evaluate how we can take what we've learned in the first 2 sessions and turn ourselves from a not in my backyard society to more of a yes in my backyard society. These things are really needed, and we don't use volunteers the way many of these other organizations do, but we really rely on folks who get it to help us help the community understand why this is so important. So you can get information about all of that on our website, handincorporated.org, all spelled out. Thank you.
All right, very good. Well, I was going to say, if anybody else wants to throw in there, jump in, because I'm going to do a real quick screen share to do something real quick. So hang on a second. Okay, basically, I want to thank all of our panelists today. This was phenomenal. Like all of them, they're over faster than I want them to be. There's more stuff I think we could talk about. Our next one coming up on what Life Copilot is sponsoring is Decluttering and Downsizing Made Easy. We have several people that are going to be involved in that. That's July 28th from 6 to 7 p.m. And by the way, today I forgot to mention this. We were being hosted by Westfield Library. Unfortunately, we couldn't be in the Westfield Library. This was supposed to be taking place live and in person, but now we're live and in Zoom. So that's where it was. August 13th, we have one coming up on how to have that family talk when you know mom and dad needs help. So I think that's going to be an important one coming up on August 13th. August 13th, also, there's that one we just did your promo for your Rolling for Hope fundraiser. Home modifications for senior friendly living is August 25th. And then of course we'll be continuing to do this. And just as a reminder, Life's Copilot, we have all kinds of different things here for you guys to come in and take advantage of. And several of you guys are members. In fact, Sequoia is our newest member. They joined last evening. So we're really excited to have all y'all with us. Thank you all for being here for this event, and just be looking for the Life's Copilot schedule, because we're going to keep doing these things because information needs to get out. So I will talk to you guys later. I hate to say goodbye, but it is time. So
Thank you.
See ya.
Thank you, Jim.
Bye-bye.
Bye-bye.
Bye-bye.